In this video, I'm going to cover squats with relation to having episodes of back pain and can you do them, when can you do them, and a few tips for getting the best out of your squats. And very similar to the deadlift video, our point is more or less identical. Now, can you do squats when you've got acute back pain? No. It's probably unadvisable to do a set of squats if you've got a bulging disc that's causing you radiating symptoms down the legs. You want to get that treated, by all means contact us or contact someone local to you who can actually treat you and help you with that. But what about when you've dealt with that, you're feeling fundamentally good and you want to strengthen your lower back, legs, etc., and you want to do squats for that? And that is a sensible move. It helps your body learn to deal with the stress and strains of gravity above and beyond that which you would normally experience on a day-to-day basis. So when someone hands you a shopping bag, you're not going to slip a disc because you're that feeble in the lower back. And that's important to bear in mind because some people will shy away from any sort of weight-bearing activity, and you just can't be like that. It's not good. So first and foremost, when you're doing your squats, make sure you have a nice lordosis. You probably heard me say this time and time again if you've seen any of our other videos. The lordosis is the natural curve in the spine. It's supposed to be there. Sometimes patients get told when they've had scans elsewhere and they come into us and say, oh, my GP said I've got a lordosis. Oh my gosh, a lordosis is normal. It's the same as having two legs. So accept that. It's a nice smooth curve and it helps your spine deal with shock absorption effectively rather than loading through the discs excessively or through a particular facet joint excessively. That lordosis absorbs shock, so it's good. You need to keep that when you're doing your squats and deadlifts. Now, when you're starting out with your squats, you want to make sure you're using a lighter weight and focusing on your technique, get good range. Because as soon as people start lifting the weights up to higher weights, instantly the bum starts to tuck under, it starts to put more pressure through the lumbosacral disc, and that's where problems happen. So keep that lordosis, keep that good form, and keep the core engaged. One thing that will help you with that, avoiding that sort of tucking under of the bum that happens when our range of motion isn't as good as it should be or when we're pushing our limits a little bit too high, is stretching out your calves. This is something I did personally where for a period of about 3 to 4 months, every time I'd go in the gym, no matter what I was training, I'd be stretching my calves out between sets because my flexibility there was so awful. And doing that really does have a massive impact on the range of motion through your squat so that your lower back doesn't become under undue stress at the bottom portion of the rep. That's very, very important. Make sure you're doing your repetitions at a lower weight and higher reps. So much like I said in the deadlift video, your reps need to become mechanical in nature so that they're straight up, straight down, the back stays nice and rock solid, and that way you can start to add a little bit of weight routinely over a period of time to increase the durability, the resistance of your back to that sort of weight, and that way it's done safely. Make sure you bear those things in mind. And one final point for lifting or doing squats when you've got a history of back pain to try and strengthen your back is do not use a belt. That's the most preposterous thing to do unless you're looking to be an elite level power lifter. You should not be doing 60 kilo squats with a weightlifting belt on, and you definitely shouldn't be using a weightlifting belt for anything else like bench press or something like that. Use your own muscles. The whole point of you doing these squats or any other exercise in the gym is to strengthen your core and its ability to deal with loading. You do not want to put a weight belt that puts an artificial pivot through the midsection of your back. It's going to mean you're going to focus force excessively either just below that weight belt or just above that weight belt when you're pushing the reps a little bit harder, which if you've listened to any part of this video, you probably won't be doing for the foreseeable future. So don't use a weight belt. Hopefully you found this video helpful, and if you did, remember you can subscribe to our channel so you get updates, hit the notification icon if you're watching this now on your desktop, and also there'll be a few videos just on the one side here that may be of interest. And remember, share the page with other people that may find it helpful. Most back pain can be resolved and avoided if it's dealt with soon or quickly with the right advice.